If you think you have a lot of money, you can influence your beauty, physiology, and keep your youth for many years just because you can afford it and you are willing to pay for expensive services of plastic surgeons and cosmetologists, then unfortunately that's not true. Let's take a look at these celebrities. They have money, connections, and all the best opportunities. They can go to the best cosmetic surgeons and clinics. All those doors are open to them. Let's take a look at the amazing results they achieved through plastic cosmetic surgery. I encourage you to watch this case study until the end, because at the very end of this video, I'm going to show you a super cool case study that's going to make you think. I want to talk to you about the first case study, which is the famous Hollywood actress Meg Ryan. Let's take a closer look at how she looked in the 90s, late 90s, and early zeros. Then we'll see how she looked after she sought out cosmetic and rejuvenation services. If we look over time from the first frame to the last frame, we can see that this patient has used a lot of fillers and lipofilling. She's had it done since the beginning and has probably tried every cosmetic procedure that's out there. As I said, she's had a lot of fillers, lipofilling, cheek area filling, and all that through fat transfer. If we look at the patient, she actually had a very nice, pretty feminine face. And if we tried to guess why she did all this for, I'd say that she saw at some point the first age-related changes, or what's called aging. She started to age and wrinkles started to appear. So she went to a cosmetologist to try to prevent this moment from happening and had all these crazy procedures done. It looks like a whole lot of fillers have been pumped into her face. We can actually see in a series of photographs how her face has progressively changed over the course of the many procedures. I think that if this patient started resorting to cosmetic services at the beginning, she realized at some point that the results weren't what she wanted, since all these procedures carry a temporary effect and you have to keep getting them redone. She's underwent a lot of these procedures and they've all been performed in large quantities. This has led to a number of complications. She's already started to run through a series of facial contouring procedures, as you can see. As a result of these facial contouring procedures, she's had a full facelift, which we can see has reversed her contouring. The result is a clownish smile, deformed facial features, and reduced eyes. This is the so-called mask effect, which also creates a difference in the structure of the skin and face. We can see just a huge, well, I wouldn't say deformity, but if we look at her extreme pictures of what she looks like, her eyes look like, and I am sorry to say, pig's eyes. They're practically completely covered from the amount of fillers, fibrous tissues, and modified structures. In my opinion, she's just lost her natural beauty. If a patient naturally and gracefully ages, then that's great. I'm not saying you shouldn't go to a cosmetologist or a plastic surgeon, but you got to do it sensibly. You need to go to a cosmetologist a little bit. You need to do it all in due time and according to the indications, and most importantly, not overdo anything. If you think the patient really disfigured herself, give this video a like and let's move on. Second case, Jocelyn Wildenstein, also known as the Catwoman. I know this woman has been extensively covered, but since we are talking about the before and after results of plastic surgeries and cosmetic procedures in the industry, I couldn't leave her out. So let's take a look at her pictures. Well, Catwoman, I think we all know why she is called that. If we look at her face, we can see why. The position of her eyebrows, the raised lateral part of the eyebrows, the slanted look, all of that, I'd say, is kind of giving Catwoman. So, what happened to her? Well, if we take another look at her over time, yes, actually, at the pictures that I found of her in the public domain, then we could characterize that this patient did the same thing as our previous heroine, resorting to a lot of fillers. And also some hardware devices used in cosmetology, that I wouldn't say imitate the skin, but they help in tightening it. These devices are used for facelifts and various rejuvenation procedures. Our following heroine got carried away with eyebrow lifting. She is, in my opinion, really overdone it. Just look at those eyebrows. It looks like she's had many facelifts, a whole lot of them, and I'd also say an excessive amount of Botox and fillers. What's in the end, the final result? The result is that we have unnatural facial features, dull facial features, and I would say that she generally has this kind of swelling in her face that I'd say that it's like she's just been stung by a bunch of bees. And so she just looks really out of place. Her eyes are unnaturally small and they cover everything. And most of all, in my opinion, if I were to put it in a more professional way, I'd characterize it as scarring deformation. That's a deformity on the face that is caused by all these procedures and surgeries that she has gone through. Because as you know, every injection, even those very Botox and fillers we use on the face, are actually punctures. Every puncture is a microtrauma, which causes tissue fibrosis. Just imagine one place that you just keep poking many times. Then, after a certain period of time, a scar will form under the skin. That scar will actually tighten the skin and give off an unappealing appearance. Something will start to change on a physiological level. That's what we can see when we look at this patient, especially on the right side of her face. She has a deformed, unnatural smile. Well, that's why she earns the second spot on my hit parade. And let me remind you that the first place winner is at the end of the video, so watch it all the way through. Our third case today is the well-known actress Janice Dickinson, American supermodel and television personality. Let's take a look at our model, TV personality, and what she looked like before all these surgeries. She's got that all-natural good appearance, she's attractive, has a natural look, and I'd also add that she's got a beautiful smile. If we look at this TV presenter, we can all relate to the idea that as we age, we start to see some changes. We've all had some sort of indication for one procedure or another, and each of us has something a little bit to fix, to correct, and probably all of us see some flaws in ourselves and would like to do something about it, and that's normal. But what she did to herself was not normal. When you have huge capabilities and the financial abilities to realize all your ideas, then unfortunately, these abnormal things happen. Sadly, they cannot be later corrected by any surgery or cosmetology. As a result, this patient underwent hypercorrection of the lips. She's had multiple brow lift surgeries, blepharoplasty, both upper and lower, all done a huge number of times. She's had multiple facelifts, so she's lost her natural look. She looks older and puffier than she used to.
Have you ever had patients who ask for more injections even though they didn't need them? Has that ever happened?
Well, I've had patients who've come to me, and when I looked at them, it was like these pictures. Well, maybe halfway there. They would tell me a story like this. Doctor, I'm now 42 and I started injecting fillers when I was 21. And when you look at this face, an unnatural face, swollen in certain places, I would say, then still I'd have some of these patients ask for more things to be injected with. And then other patients would ask to have it all removed. For example, this patient that came to me was 42 years old. She asked me to remove all these fillers from her face. I had to refuse such patient because it's just impossible to do. Or there were patients, for instance, who came in with huge lips, like 6 ml or more. I'm having a hard time to even count how much and how overstretched the soft tissues of the upper and lower lips were. They came in for more filler injections. And so such patients I also refuse because, in my opinion, that would be, before anything, unprofessional of me, because I know at this point it's just harmful to her health. The second reason is that I do aesthetics, and this is already unesthetic, so I personally don't see anything aesthetic in this. That's my opinion, so I refuse such patients. In general, I try to work with fillers very rarely, and I work with fillers only on, generally speaking, strict indications. If I do some surgeries on patients and then I need to do something like inject a filler or some other toxin somewhere, I actually do it. Otherwise, in general, I try not to resort to filler injections. If you're looking for a procedure to help you look younger or support your natural beauty, and you are looking for a proper doctor who won't do everything purely according to your wishes and so on, but instead, they'll strictly follow the indications that will maintain something for you, improve certain things, or preserve what you have, then follow the link in the description and sign up for a consultation. I'll be happy to walk you through what you should and shouldn't do, as well as what you should and shouldn't contraindicate. The fourth case we have with you today is that of Melanie Griffith. This is an American actress who was also super popular some years ago. She's a wonderful, beautiful woman. If we take a look at this patient, this wonderful actress who was mega popular in her years, and compare her pictures before all the cosmetic procedures, then again, in my opinion, I think that in this case, the patient looked younger, more natural, and better before all these procedures than she does after a certain period of time and after all the, in my opinion, the horrors that she's underwent. By horrors, I mean the overabundance of fillers. Again, all the possible, Botoxes, fillers, blepharoplasties, repeated facelifts, as we can see, rhinoplasty. The result is that the face just lost its natural look. The skin became lumpy, uneven, and we can see a lot of different pulls and adhesions in the superficial layers of the skin. Why superficial? Because she has almost no subcutaneous fatty tissues left. She actually has skin, fibrous tissue, facial bones, a jaw, and it all looks frankly a little bit ugly to me. Let's take a look at her pictures over time, before the procedures and what it all led to. Looking at her before pictures, we can see the wide smile, the open look, and the beautiful shape of her nose. But if we look at the last photo, we can see a pronounced asymmetry on the face. And despite having had multiple facelifts, we can still see these rather pronounced nasolabial folds, also known as the marionette line. Quite rough, I would say, or no outline of the lower jaw at all. Simply saggy skin that just doesn't have any support. Because again, it's just fibrous tissue under the skin, which can't hold the skin in place. It just creates folds and sagging.
Can you tell us what makes girls abuse themselves like that?
I think it's important to remember that people in the show business industry, especially actresses and models who are filmed a lot, they are well aware that their livelihood depends on their appearances. As a result, they, on a psycho-emotional level, begin to fear this aging factor. They think that if they get older, they'll become unpopular, less recognized, unattractive, and thus make less money. So, a lot of people in this industry try to, so to speak, invest in themselves, in their appearance.
Prick themselves and poke their entire faces with syringes. But what the hell is going on? Why do they resort to these countless injections?
I'll explain. They start injecting themselves, but as you already know, and this information is publicly available, that all these fillers have a temporary effect. It all works for 4 months, 5 months, 6 months it works. You actually have to keep injecting it to maintain the effect. Then you don't just maintain it, but you actually increase the amount of fillers. And it turns out that on one hand, you're traumatizing yourself, and on the other hand, you overstretch the tissue somewhere. Then what happens? Everyone says the filler resorbs and dissolves. There is no way in hell the filler resorbs. Some components of the filler dissolve, yes, but some gels and other chemical substances remain under the skin. They don't go anywhere. They remain as foreign objects. It's well known that when we poke all these foreign objects in, our immune system reacts. And if something gets inflamed, what gets formed there? Fibrosis. It's quite simple. So, what happens next? You realize that the fillers don't work. She's been in there for a year or two. That's how long it took. What is the right amount of fillers that should be injected? It really depends on each person's individual level. Some need more, some less. If it's not working, the next step is surgery. Then it turns out that you do one thing and it leads to something else. You want to do one thing, you do another thing, and something else gets added. It's like a cycle, like a vortex in which you are sucked into. You gradually forget yourself as you fall into this vortex. That's how it goes. Especially when you have the financial capabilities to make your ideas a reality. Guys, please share in the comments, maybe some of you have such friends, if you know anyone who's had the same problem. Write about it in the comments, I'd personally love to hear about it. And now the fifth case, my friends. In my opinion, it is the severest, most insane one, and it's of an actress, singer and model from the 60s. Her name is Sydney Rome. Let's take a look at what happened to her. In her youth, the actress looked super mega beautiful, in my opinion. Take a look at her big wide forehead, those big open eyes. She has a really interesting look. Her nose structure is harmonious. She has a beautiful smile and lips. Her jawline is perfect. It's the middle zone of the face and the lower zone of the face. Everything about her was quite harmoniously put together and proportionate. But when age and the age-related changes knocked on the door, the singer in question decided to tackle it head-on. Let's see where it all led to. The first thing, of course, our actress turned to a cosmetologist, and to maintain her youthful appearance, she started using fillers, Botox, and other beauty treatments. This is a common procedure. She tried different types of devices. In fact, these types of devices are very popular in the United States and other countries. There are many different machines that perform different functions, from skin cleansing to facelifts. They all work in different ways. But, unfortunately, all this doesn't go unnoticed. If at the beginning of her journey, let's just say she looked pretty good when she was young, then at some point, you'll excuse me. But it's like something happened to her, I would say, irreparable. It's not only that she's lost her personality, her facial features, her structure, but also that pleasant appearance, that open look. After the surgical interventions, when she started to resort to it, we can obviously see that here right away. And full facelift and blepharoplasty and everything you know in terms of anti-aging facial surgery. This patient has tried just about everything. And we can look at her and see that not only does she have asymmetrical facial features, but I would say that she has developed a deformity. It looks like she has a deformity in the mid-facial area and in the lower third of the face that borders the upper neck, so the orbital area. We just see quite a very pronounced asymmetry. From looking at her pictures, it seems to me that she had a surgery that was no longer aesthetic, but rather a reconstructive one. As a surgeon myself, I can see that she has a pronounced deformity in the muscles that encircle the mouth. It also looks like an unnatural, asymmetrical facelift was performed, with one side of the face being over-tightened and the other side feeling like the doctor didn't do enough. But it's not really about the doctor though. It's that the tissues have already been altered so much by the number of the procedures that they don't have a good blood supply anymore. They're basically losing their vitality and all the nutrients that promote repair and regeneration. Basically, she has one continuous scar underneath her skin, and this very scar is what causes the deformity that we can see on the skin. And so, as you can see in the last picture, it seems that the situation seems to have improved a little. However, in my opinion, she still looks strange, putting it mildly. But if to put it bluntly, she looks totally scary.